The medical question that still baffles. Doctors, how can you predict a stroke when there are no symptoms? It may sound impossible, but the answer is, yes, you can. If you know how to read the silent signs from inside your body, just like ancient military strategies taught, know yourself, know your enemy, and you will never be defeated. In health, especially with silent strokes, the invisible killers of the brain, knowledge is your radar. Understanding the hidden damage inside your blood vessels and the quiet whispers from your body could help you stay one step ahead, even without a single obvious symptom. Silent stroke, the hidden enemy of the brain. A silent stroke occurs when a small area of the brain is damaged due to a temporary interruption in blood flow, depriving brain cells of oxygen and nutrients. Here's the danger. You don't feel anything dramatic. No slurred speech, no drooping face, no sudden weakness. Why? Because the affected area often isn't responsible for obvious movement or speech, so the damage flies under the radar. Instead, the clues are subtle: mild confusion, forgetfulness, or trouble focusing, often dismissed as just aging. This is why silent strokes have earned the title, the most dangerous strokes you don't know you had. How to detect the whispering clues of a silent stroke. Despite the name, a silent stroke is not completely silent. Your body might still be speaking, but only if you know how to listen closely. Watch for these under-the-radar signs: unusual memory problems, struggling to remember recent events or concentrate like before; emotional changes, becoming overly emotional, laughing or crying at odd times, or losing control over feelings; unsteady walking, difficulty maintaining balance or feeling unsure while moving, even on flat ground; mild disorientation, getting confused in familiar places or struggling with simple tasks; unexpected bladder issues, trouble controlling urination without other obvious cause. The hidden danger of silent strokes. Damage you don't even know exists. Here's the scary part. Brain damage caused by silent strokes is often discovered by accident during a CT or MRI scan ordered for an unrelated health concern. So just how dangerous is this silence? Don't be fooled. Every tiny brain lesion caused by a silent stroke is permanent. And over time, these invisible injuries accumulate, silently chipping away at your memory, cognition, and quality of life. The cumulative toll of silent strokes, a ticking time bomb in your brain. It's a mistake to think of silent strokes as mild or harmless. The damage they leave behind often results in a progressive decline in brain function. Not just occasional forgetfulness, but a clear reduction in focus, processing speed, and logical thinking. Worse still, silent strokes significantly increase the risk of developing vascular dementia, a serious degenerative condition where reduced blood flow leads to long-term cognitive impairment. But it doesn't stop there. Silent strokes are now recognized as a major warning sign of future, more severe strokes. If you've already had silent damage to the brain, your chances of suffering a full-blown stroke with lasting disability go up dramatically. Mood and behavior changes are also common. Anxiety, depression, and emotional instability often creep in as the brain struggles to function normally. Experts warn, silent strokes are far more common than dramatic, full-symptom strokes. That means millions may be living with brain damage without even knowing it. And remember, whether loud or silent, stroke is still one of the leading causes of death and lifelong disability worldwide. To truly understand the threat, we have to go back to the most common type of stroke, ischemic stroke. Here's how it happens. Blood is pumped from the heart through the carotid arteries in the neck. These arteries branch into smaller vessels that supply the brain. One of the most critical and vulnerable areas is the middle cerebral artery, MCA, a high-traffic zone where over 80% of ischemic strokes occur due to a sudden blood clot blocking the flow. What is a blood clot, really? A blood clot is made up of platelets, tiny blood cells, combined with a natural adhesive protein called fibrin. In healthy situations, clots are life-saving. When you cut yourself, your body quickly forms a clot to seal the wound and stop the bleeding. But when this system goes haywire, when a clot forms inside an artery with no injury present, that's when it becomes a deadly threat. When blood clots turn deadly, and the hidden triggers behind most strokes. Blood clots become truly dangerous when they form abnormally inside blood vessels, especially in arteries already damaged by atherosclerosis. In some cases, a clot doesn't form right where the blockage occurs. It may originate elsewhere, like in the heart or from a ruptured plaque in the carotid arteries, and then travel to the brain, getting stuck in a narrow vessel and cutting off blood flow. This leads to an ischemic stroke, where brain tissue is deprived of oxygen and begins to die. Depending on how quickly it's detected, doctors may use clot-busting medication or perform emergency procedures to remove the clot and restore blood flow to the brain as fast as possible. But here's the key insight. The real problem isn't just the blood clot itself. Treating only the clot is like putting out a fire without asking why the house caught fire in the first place. The clot is a symptom. To truly prevent stroke, we need to go deeper, to uncover what's causing these clots to form in the first place. High blood sugar, the silent trigger. Elevated blood sugar is a major culprit. It causes oxidative stress and damages the inner lining of your arteries, making them more vulnerable to inflammation and clot formation. This is why people with diabetes, prediabetes, or insulin resistance have a much higher risk of blood clots. A high-sugar, high-refined carb diet turns your arteries into a battleground, inflamed, fragile, and prone to rupture. But it doesn't stop there. Sugar also activates your sympathetic nervous system, the fight-or-flight stress response. That means your body is constantly on edge. Faster heart rate, elevated blood pressure, widespread inflammation. This creates the perfect storm for cardiovascular trouble to take root. Adrenaline, fueling the fire. Adrenaline, epinephrine, your body's stress hormone, spikes under chronic emotional pressure. It causes blood vessels to constrict, raises blood pressure, and accelerates inflammation. And here's the kicker. Even if you're not eating sugar, stress can make your body generate more glucose on its own, further worsening blood sugar levels. Conclusion: sugar plus stress equals a dangerous duo. When a high-sugar diet collides with chronic emotional stress, it creates a toxic cocktail, a perfect recipe for blood clots, stroke, and other heart complications. These are the underlying root causes we must identify, understand, and take control of if we truly want to protect our hearts and brains. Chronic stress has many faces, but emotional loss is the worst. Not all stress is created equal. Many forms exist, but emotional stress, especially grief or loss, can be the most devastating. Losing a loved one, a job, money, or anything that deeply matters to you can trigger intense biological responses. In fact, this type of stress is linked to the broken heart syndrome, where heart attack risk can rise by up to 2,000% in the days following a major emotional loss. Hormones and medication, the unseen risk. We also need to talk about medications, especially hormone replacement therapy, HRT, and birth control pills. Both introduce high levels of estrogen into the body, which can increase the risk of stroke and blood clots, particularly in certain high-risk groups. 4. Smoking. How inhaling a puff can lead to a stroke. You might wonder, how does smoking, even though it's inhaled into the lungs, end up causing a stroke? Here's how. The smoke and its toxic chemicals enter your lungs, then pass straight into your bloodstream, traveling all the way to your brain. Once there, cigarette smoke triggers a cascade of oxidative stress, free radical damage, and widespread inflammation inside the brain's delicate blood vessels. Over time, this creates the perfect environment for blood clots, plaque rupture, and vascular injury, all precursors to stroke. Number 5. High blood pressure, the silent force that bursts vessels. Next is high blood pressure, also known as hypertension. This one's straightforward. Chronic elevated pressure inside your arteries can cause a blood vessel in your brain to rupture, leading to a hemorrhagic stroke, a medical emergency where bleeding in the brain causes rapid cell death. But here's something most people don't know. Up to 90% of all high blood pressure cases are labeled essential or primary hypertension. What does that mean? It means doctors don't have a single clear cause for the condition. It's not tied to a tumor, kidney disease, or some identifiable structural issue. In most cases, it's influenced by a complex mix of lifestyle, diet, and metabolic imbalance. So no, you're not doomed to just have high blood pressure. There are root causes you can address to lower your numbers naturally. The hidden triggers behind most cases of high blood pressure. Let's take a look at some of the invisible forces driving your blood pressure up. 1. Insulin resistance. A high sugar, high carb diet stiffens and thickens your arteries over time. When arteries lose flexibility, your heart must push harder to pump blood, raising your blood pressure. Once again, it all loops back to our first major villain, chronically high blood sugar. 2. Potassium deficiency. You may not think potassium has anything to do with blood pressure, but it does. Potassium helps your blood vessels stay soft and elastic. Without enough potassium, your arteries become rigid and blood pressure climbs. Many studies confirm that adequate potassium intake helps regulate blood pressure naturally. So, where does potassium come from? Mostly from magnesium-rich vegetables, especially dark leafy greens like spinach, kale, and Swiss chard. Here's the problem. The average person eats barely a cup and a half of vegetables per day, when the ideal is more like 7 to 10 cups of salad greens or 4 to 5 cups of cooked veggies daily. Low potassium levels can also lead to irregular heart rhythms, including atrial fibrillation, AFib, which is another major risk factor for stroke. And then there's vitamin D deficiency, a condition that affects a large portion of the population. Low levels of vitamin D can trigger chronic inflammation, increasing your risk for prediabetes, type 2 diabetes, and insulin resistance. That's why I always recommend getting adequate amounts of vitamin D and potassium, and following a low-carb diet. This combination has consistently shown to help manage high blood pressure, which in turn lowers your stroke risk significantly. So when we talk about predicting a silent stroke, look at the pattern. If someone consumes a lot of carbs, is diabetic, rarely eats salad, lives with constant stress, and is physically inactive, those are the real culprits, the red flags that often foreshadow a stroke. So where should you begin? Consider adopting a ketogenic diet with intermittent fasting. This combo is incredibly effective in controlling blood sugar, reducing inflammation, and supporting vascular health. Don't skip the greens. Make dark leafy vegetables a daily habit. They're rich in natural potassium and magnesium, two vital minerals that help regulate blood pressure and support heart function. Start moving regularly. Physical activity improves circulation and helps your body burn off excess adrenaline, the stress hormone linked to irregular heartbeats and higher stroke risk. And don't forget to nourish your body with essential vitamins, especially B, C, D, and E. These nutrients play a key role in protecting your blood vessels, fighting inflammation, and boosting your immune system. Important. Note: the information shared in this video is for educational purposes only. It is not a substitute for medical advice. Always consult your doctor, especially if you have an existing cardiovascular condition, before making changes to your diet, lifestyle, or medications. This channel is here to help you understand your body better, so that together with your doctor, you can make more informed health decisions.